Hi everyone and welcome to this new video on the vertebral planes. As already discussed, I'm Dr. Ankit Khandelwal, Professor Anatomy, and welcome to my channel Human Anatomy by Dr. Ankit. So let's jump onto the topic. So here in this image we can see all the fused vertebrae over here. We have 26 vertebrae, and this is over here. Number 1 labeled is the anterior view. You can see the cervical vertebrae, the thoracic, the lumbar, the sacrum, the coccyx. The figure number 2 over here is the lateral view over here, and you can see the curvatures of the vertebral column that we'll discuss. And figure number 3 over here is the posterior view, as you can see the spines over here of the vertebral column. Now if you look at the curvatures over here, the posterior curvature of the thoracic vertebrae, that is known as the kyphosis over here. And for the cervical and the lumbar vertebrae, we have a anterior curvature that is known as lordosis. So cervical and the lumbar vertebrae over here, they are anteriorly convex, and the thoracic vertebrae is anteriorly concave. Now as we move down, here is the main tables over here. The reference is from the latest edition of the Gray's Anatomy, so you can rely on it. On the left column we have the spinal levels, and the right column we have the viscera over here. And do remember, at few places the level of the spine, as you go down in the vertebral column, they will correspond with the body of the just immediately lower vertebrae. That is, the T6 spine will be somewhere around the body of the T7, somewhere around it. So let's proceed one by one over here. So here we have a spine of C1 vertebrae, and we have the hard palate over here, very important. At C2 we will have the angle of mandible, that is between the ramus and the body. At C3 we have around the hyoid bone over here. Around the C5 spine, we can also call it as a C6 vertebral body, we will have the mainly cricoid cartilage, and also the beginning of the esophagus. Now here we can add a couple of more things, that at C5 spine or C6 body we will also have the beginning of the trachea. So trachea will also begin over here, and you can also say the pharynx ends over here. At C7 spine we have the superior limit of the apex of the lung, so that is very important, where the apex of the lung lies, so you can have a good idea of it. At the T3 spine we have the medial part of the scapula, that is a bone on the posterior aspect, so that is if you look at it posteriorly. And also at T3 spine we'll have the superior limit of the oblique fissure of the left lung. Okay, at T3 T4 spinal junction, or we can say the T4 T5 body junction, we have the sternal plane over here. Sternal plane, also known as the angle of Louis, we will discuss more of it in a while. At T4 spine we have the superior limit of the oblique fissure of the right lung. So make a difference of the fissure of the left and the right lung, there is a difference of around 1 vertebral level. At the T5 spinal level, or you can say around T5 T6 body, we have the bifurcation of the trachea, so it lies a little below the sternal angle. At T7 spine, if you look at the posterior aspect, we have the inferior angle of the scapula. At T8 spine, or we can say around the T8 body also, we have the IVC, that is inferior vena cava, that is going to pierce the diaphragm, and it is going to enter into the right atrium of the heart. Okay, so these are very important, we can say, the vertebral plane levels. As we move to the second table, as we are proceeding down, we have over here the T9 spine level, we have the xiphisternal joint, that is the lowermost part of the sternum. At T10 we have the esophagus, that is piercing the diaphragm and coming down and forming the stomach. At T11 we have the superior limit of the superior pole of the kidney. So the kidney is around 9 to 10 centimeter in length, maybe a little bit, a couple of more centimeters. They span around T11 to, you can say, around L3. At T12 we all know that we have the aorta, that is piercing the diaphragm, and at this level only it gives off the celiac trunk. Also T12 will be the lower limit of the pleura. At L1 we have the transpyloric plane, or you can say L1 spine, so lower part of L1 we have the transpyloric plane. Again, this plane along with the sternal angle, we will discuss them in a bit detail in a while. At the level of L3 spine we have the subcostal plane. At L4 vertebral level we have the bifurcation of the aorta. So the aorta, the abdominal aorta, bifurcates into the two iliac, the common iliac arteries. Also at L4 we have the supracystal plane, that is the highest level of the iliac crest, also known as certifious plane. At L5 we have the beginning of the IVC, because IVC begins from below. Okay, the fusion of two common iliac veins, they form the IVC. And also around the L5 you have the inter or the transtubercular plane. At S2, okay, the sacral, we have the PSIS, the posterior superior iliac spine, and also we have the termination of the dura mater, arachnoid mater, and also the subarachnoid space. Okay, so these are very, very important two tables over here. Please take a screenshot if you wish to. And then you have details of these two important planes, the sternal angle or the transpyloric planes. I would advise you guys to take a screenshot of it and save it with you and revise it. Let me go through the important pointers over here. That around the sternal angle, that was around T4 and around T4 T5 body. The important viscera, important features which appear are the two parts of mediastinum meet. The second costal cartilage articulates the sternum with the beginning of the you can say the descending aorta and the ascending aorta ends. The arch of aorta begins and ends. Bifurcation of trachea normally is given over here, but it lies around one vertebral level below. The pulmonary trunk divides into right and left pulmonary arteries. The azygous vein drains into the superior vena cava. The thoracic duct crosses from right to left side. Here the deep cardiac plexus, and left and right pleura also meet in the midline over here. And at the transpyloric plane, that is around the lower part of L1, where we call it as the transpyloric plane. The pyloric over here refers to the pyloric under the stomach also. So at this transpyloric plane, we have the tip of the ninth costal cartilage. We obviously have the pyloric under the stomach. The hilum of the kidney lies around over here. Remember, the T11 was around the upper part of the superior pole of the kidney. And around this transpyloric plane only, we have the spinal cord ending in adults. Remember, in infants, it is the L3 level where the spinal cord ends, in infants only. We also have the neck of pancreas at the transpyloric. We have the superior mesenteric vein joining splenic to form the portal. We have the gallbladder fundus. We also have the superior mesenteric artery origin over here. So these are important obviously viscera which I was pointing out. And here's an image showing about the lumbar puncture being done and relevance of the supracrystal plane, that is around the L4, which guides us to do this. Here's an image showing us important you can say some muscular tendinous landmarks over here, right from trapezius over here to rhomboids to latissimus dorsi to rectus spinae to around this PSIS level over here, which is, we can say, around this level of S2 vertebrae over here. As we go down, is also you can say the abdominal X-ray over here, showing us basically the vertebral column in between, and also important viscera, whatever we can figure out from the given X-ray. You can take a screenshot of it and just read it out, might help you. Here we are showing you an image where the neck is slightly flexed over here and the arms are being this pulled forward or protected to show you few spinal levels over here. So you can see the C7, that is the vertebrae prominence, and T1 also. So these both C7 and T1, their spinous processes are more prominent, and subsequently you can see the T3, the supraspinous, and the T4 spinous processes. Here's again so you can say it is an MRI over here showing us all the lateral view, showing us important curvatures and also this important vertebral bodies and where the spinal cord ends. Again, you can take a screenshot of it. Focus basically where we have the S1, where we have the L5 over here. So there's we can figure out about the prolapse disc or any other diseases like that. Now, coming to the last part, the PYQs over here, just to show you the PYQs. I'm not going to discuss all of it. These you must be doing it, but just to show you the relevance of why this topic I have kept as an important topic. Here you can see the important questions of coming from it, right from the identify the marked blues. There's a dermatome over here that is umbilicus area around T10. Then again the umbilicus question came, but now they were asking about the vertebral level, so it lies around L3 L4 junction over here. And remember what is happening at L4, the bifurcation of aorta. The thyroid gland they have asked in a lateral X-ray. The ABCDs are given over here. They ask about the extent of thyroid gland. Also do remember the isthmus of thyroid gland, it lies around somewhere around C7 vertebrae, that is below the cricoid. Then here they ask about the vertebral level again of the part of 2, that is around the lower part of the rib, around the subcostal plane you can say. Highest point of iliac crest was also asked, that is again supracrystal plane around L4. Here they are asking about the what vertebral level does the marked part in the image lie in the normal anatomical position. So they are asking about the ischial spine over here. So that is again we will be lying around the middle of the sacrum, somewhere around the S3 spine over here. So So this all these things we should be knowing the vertebral planes. Given cross section, they're asking here. You can see the liver, the stomach, a bit of spleen over here, a bit of IVC over here. So that roughly around T9. Details of it you can also see in the PYQs. These are all PYQs over here. But just to give you an idea, you have the IVC in the aorta over here. Okay, so it is a bit higher level. You can also see the stomach and a bit of spleen over here. But yeah, it lies around T9. And the question, so all these questions, this is asking about the sternal angle over here. So my point over here is that all these questions on vertebral planes, they have been asked you in the NEET PG exams, okay, in INI-CET and in FMG. So you take any nationwide exams and they have asked questions. These are all the PYQs from the last 3 to 4 years max to max. So that was all about the vertebral plane, guys. I hope you took the screenshots of it. If not, then please do, and try to revise it, and I hope a question comes and you solve it. That's all. Bye bye, and all the best, guys.